I'm Kirsten Furl. I am the alumna representative of the UT Health School of Nursing. And Amir, I didn't know you had that diagnosis. I'm a gastroenterology nurse practitioner, so we should talk after that. But so excited to share my story. It's pretty honoring to be, or honorable, I guess, to be here with some pretty awesome alumni who've done a bunch of really great things, even students who have done really great things. And I feel kind of small in comparison because I've only been working for one tiny little year. But what I want to focus on today and talk to you about is the things I've learned in this 12 months. Like I said, I just celebrated my 1-year anniversary where I work. I work down in Floresville. I am a nurse practitioner down there. I graduated with my B.S.N here in 2014 and then got my master's degree, went right through onto that. And one thing that they don't tell you about, they didn't tell me about exactly, was how stressed out you're going to be your first year, how anxious you're going to be. I still feel like I'm killing somebody almost every single day, even if I prescribe them like omeprazole and it's not that big of a deal. But I'm just now getting to a point where I get a full night's sleep, so that's really exciting. But I think what never strayed and what never left me was compassion, was getting the good connection with that patient. And if you have that from the get-go, if you start doing that right off the bat, you'll be okay, because confidence will come, leadership will come, all these great experiences will come, but for right now, don't ever stray from what we're taught and from what's the most important thing. And it's so inspiring hearing all of you guys talk, especially about nursing. To me, what separates nurses from other healthcare providers and what really defines us the most is our heart, is our willingness to do the dirty work, to care when others won't, and to be there for the really hard parts. And that's something that really inspired me to be a nurse. I come from a long line of medical professionals, including doctors and surgeons, and nursing was what really inspired me. Actually, I'm an English major, first off. I wrote for magazines for a few years and then got bored and became a librarian and got really bored. And then, nothing against books, I love those too. But when I decided to go back to nursing school, it was because there was that element that was missing, that element of heart and caring and really being able to connect with people and kind of being forced into it, because at the end of the day, we're much better at our jobs. We're gonna have much better patient outcomes if we're sitting there and we're listening and we're connecting in a way that we really don't get to. So I would strongly encourage all of you, especially students, when you get your first job, to make that a priority, to focus on getting good information. You're going to forget to send a med, you're going to forget to order labs, you're going to make mistakes, but what will save you in the end and what will always be there is the fact that you remember your patient's granddaughter's birthday party and that they had to wear pink. And it was funny because I have so many patients that those little details matter, and they'll forgive you a lot if you focus on that. So I do want to take, one of the biggest things that I've learned this last year is you spoke well of this, is take advantage of all opportunities. I don't know about you guys, but dermatology was a really big deal back in the day when I was in grad school. We all wanted to do derm. That was like so cool. We're trained in family practice though. We're trained in primary care, but we do get the opportunity to do a specialty rotation. And so I, along with like 30 other girls, were like, all right, let's do derm. It's gonna be great. We're gonna learn, Botox and fillers and acne, which looking back is kind of silly to me to think about. But I put in my request for dermatology and didn't get it. And I opened my email and I was so excited. I was going to go learn all these great things. And I've got my family practice location and gastroenterology, Texas Digestive Disease Consultants. And I was like, oh, that's not at all what I wanted. I don't care about GI. I don't want to talk about poop all day long, because in my very small brain back in the day, that's what I thought it was. And so I called the coordinator and I was like, you got to fix this. I really don't want to do 150 hours in GI. And she's like, all right, Kirsten, you can either do 300 in family practice or figure it out, just do something else, because it starts in a week and you've got to make this happen. So I submitted to GI, and naturally, as the story goes, 48 hours into it, I was hooked. I was hooked. I loved it. And it wasn't necessarily that I loved GI. I mean, obviously, it's more than poop, as you all know. But it was so great to learn about liver and biliary, and it just was fascinating. But it was neat to see the specialty side of care. Like I said, we're trained in family practice. We know how that goes, but what's so nice is in family practice, you get the patient who's got fatigue and depression and neuropathic pain and also constipated, but so many different things, and you can fix maybe one or two of them and maybe shuttle them off to somewhere else. But with specialty, you get a definite set of symptoms, and you get solutions right away. And not right away, it may take a few months, but that was really satisfying and something that I loved so much. And so, as luck would have it, in the last few weeks of my family practice rotation down in Connally, they said, we love you, this would be such a great fit for you, we wish we could hire you, but there's just no room for an F&P. But there's a gastroenterologist here, and he is so booked. He would love to hire a mid-level, but there's no way you want to do this, right? And I was like, yes, I do. I love gastro. Please hire me. And I followed him for 8 hours and was hired on the spot. So I look back on my last year, and I have learned so much, but it has been so rewarding, so satisfying. And if I wouldn't have said yes to that, it wouldn't have worked. So within 12 months, I have, just learned so much, become more confident. Like I said, I'm sleeping well at night, so that's good. You've got that to look forward to. But at the end of the day, never let go of that compassion, never let go of that heart, never let go of why we started this. Connect with your patients, love on them as much as you possibly can, and don't forget granddaughters' birthdays, because they do make a difference in the end. So good luck to all of you guys. Thanks for coming out, and if y'all need anything, let me know. I'm in Floresville, Texas.